Welcome, everybody, and good morning early on the west coast of North America. And I think we're broadcasting as well into Europe as well, which is probably a little later. Let me introduce you to the topic we are hosting today, how digital dentistry can help your business bounce back. My name is Brian Connolly, and I work for Medit, based out of South Korea, and we manufacture digital scanners, tabletops, and iOS scanners. Our guest today, and who will be sharing his insight on what's going on in the world today with the pandemic and how it affects dentistry, is Dr. Brenes, Christian Brenes. He's a prosthodontist and associate professor at the Medical University of South Carolina. He has been a key opinion leader for Medit since 2018. He is a national and international speaker for Medit and other CAD/CAM companies. Welcome, Dr. Brenes.
Thank you, Brian. It's always nice to be considered for this kind of webinars and collaborate with you guys and with everybody that we can.
Yes, well, I mean, obviously we're talking in time where things have been a little tough out there for the dental world. I know in our past encounters, whether it be in Germany, I know you've traveled to Japan for us to do some lectures.
Yeah.
Those are the good times. That's when things were really kind of popping in this space of digital dentistry. And I think really kind of what's going on now with the pandemic is, it's the what if, how are we going to all get back and jumpstart everybody's businesses to kind of really excel again, as everybody had in the past. I was wondering if you could just give us a little insight of what's going on in your world with this pandemic happening, and whether it be the university environment or any other environment in the dental space, if you could share a little.
Yeah, well, as of today is April the 24th, and the last couple of weeks have been hard, quite honestly, just because we don't know actually what is going to happen. The uncertainty in different dental practices, dental labs, the whole world is actually uncertain right now. We don't know what is going to happen. We don't know if we're going to have specific protocols to be able to fight this virus. At the beginning, I will be honest, I thought it was something like, possibly a flu or something. I never thought it was going to be this bad. After seeing what was happening in South Korea a little bit, not too much, but like Italy, Spain, it became really sad, and it's really hard for us to really understand what is going on right now. Who would have thought like we were going to be dealing with this? Nobody. At the university, we're just trying to deal with the fact that we have to see some emergencies from patients. So we have to see these patients, we have to treat them. But when I say emergencies, are like true emergencies. We're not doing any elective procedures. We're just trying to minimize exposure. It's a little different than like private practices. We see a lot of patients every single day. So we're just trying to protect the patients, the staff, people in general, because we know right now, at least in South Carolina, it seems like the peak is going to be early May. So we can go through that peak and then kind of like flatten the curve. Then what we're expecting is maybe the summer is going to help us a little bit. We don't know yet if the virus is going to be somehow affected by the temperature, but we're expecting to open in the next couple of weeks and get back to or closer to normal operations, whatever that is going to be.
Yeah, no, I mean, normal is kind of that new, what does it mean? And it's interesting. I've traveled to South Korea many times for work, and the South Korean population in general, wearing masks is not abnormal. The air quality at some times tends to be a little difficult. So wearing masks is relatively a normal thing. If people are outdoors and the air quality is not there, I'm wondering if those are the types of protocols we'll see at least for the next few months to ease, whether it's an uncomfortable aspect of going into a dental space or what have you for both. I mean, I know the clinical staff in most environments in the dental space are very well educated on those protocols, gloves, masks, asepsis, and keeping, spaces and surfaces clean. That's been normal. So I would assume it's more for the patient's benefit, from a comfort level coming in, correct?
Yeah, I mean, the whole population, right now, this is a public health issue. So, the virus has impacted everything, from the way that we practice dentistry to the whole economy. So who knows really what the protocols are going to be from now on. We have been busy here at the school trying to have some sort of plan Bs ready. By plan Bs, I mean trying to design and print some masks, some face shields in case we run out of medical supplies. That's something that we see that is happening in some more countries. Quite honestly, that's what we're doing. We're just getting prepared to worst case scenarios. So if we get into the worst case scenario, we were prepared already.
Yeah.
But
yeah. So I mean, I think I see dentists, and I've known dentists and their staff for many years. They spend a lot of time on the education side of things for their patients. Obviously, there are treatments and treatment plans and things of that nature, but conveying that information back to the patient is so critical. I would assume a lot of that is going to be important going forward, from a comfort standpoint, just so the patients are comfortable to come back into the space. But then when you're going to go through a treatment plan and all the different steps, I think patients possibly, in my opinion, is that they'll be more inquisitive of why are you doing this and what does this affect. I mean, and this is really where I want to try to tie it into maybe possible solutions. I think they're all there today. I think you, of all people, have been involved in digital dentistry for a long time. And really what I would ask you here is, just to kind of walk us through this digital workflow and how do you see yourself conveying some positives back to patients of how a treatment plan using these types of tools or technology can assist or alleviate any of those types of fears.
Right. I mean, obviously, as dentists, we are one of the professions that are most at risk because most of the elective procedures we use handpieces and we create aerosols. So when you create aerosols, you spread the virus everywhere, basically. And it can lead to not only infect the staff and the dentist, but also do or create cross-contamination. So, if we talk about the good, the bad, and the ugly of this pandemic, I'll probably say the good has been that this situation has put us in a position that as clinicians, we need to follow more strict personal protection and hygiene protocols. And that will help our patients, but also it will help prevent some more diseases that, back in the days, we were not following this kind of protocols. So it's probably going to benefit the whole population in general. From that standpoint, the bad obviously is the immediate impact that it has with the economy. It has impacted a lot of different practices. A lot of friends that I personally know and people that I just know from the social media world, they have been impacted, and some of them in a really bad way. Some of them have fired personal Some of them is really, really sad, but they have gone bankrupt just because they're not producing, and they have expenses. They have fixed expenses that they have to pay every single month. So even though at least here in the United States, the government is helping small businesses to just keep going, there are some of them that were not prepared. I mean, who would have thought, as I was saying, who would have thought this was going to happen just like that? The ugly, I would probably say, in my personal opinion, is going to be the unknown. As I was saying, there are so many different questions, so many questions that we have. Even when I talk to experts, virologists, pulmonologists, people that are like really involved with this kind of diseases, there are a lot of things they don't know. So that's the ugly part of this, because the real question is how long is going to take us to find a true solution to go back to normal operations.
Yeah.
For example, we don't know yet if there is true immunity. So even people that have been infected by COVID-19, we don't know if after they develop antibodies, they are actually immune to the disease. It seems like from some reports, like they're not. So we have to think about, okay, well, we need a vaccine. And people in the healthcare industry, they're working really hard to try to get this going. But it's probably going to take a few months, if not maybe, we're talking maybe a year and a half to do all the clinical testing. It's not as easy as just like, hey, let's go ahead and inject whatever, right? They have secondary effects. They have to follow up with the people that are willing to, try them. Is very hard. So, in the next couple of months, I guess what we're going to see is how we can change the way we practice into a way that we can reduce exposure as much as we can. We were just talking, and I told you, this is just a matter of luck, because you don't know. Like, you can get it tomorrow, or maybe you will be kind of immune. There are some people that have really good responses to the infection. They don't develop any symptoms, almost any symptoms at all, and there's some people that are actually dying. So it's just a matter of luck, actually.
Yeah. So I mean, it sounds like from your perspective, there's a lot of things that have to happen for us to get back to normal, but maybe there's some things that in the dental community we can control. And it kind of reminds me, going back to 2003. I'm one of the older guys in this space, and with SARS, and how that really kind of got everybody to stop and look. And I'm sure it's happened previous to that, in the whole way that we transfer information, because in the dental community, whether you are in it or not, there are multiple aspects of the dental community. There are dental laboratories, there are dentists, there are specialists that send, so everybody's moving the treatment plan around in a way of putting it, through this workflow, and whether it's analog or digital. And I do remember how digital dentistry really got kind of not its infancy, but kind of a boost back in 2003, when people started looking, what are the small things I can do to control at least one aspect? In today's world, maybe I can wear a mask so I don't infect somebody else if I was. But in the digital dentistry space, it's that shipping of the impression. If you're an analog dentist, maybe I don't want to take a conventional impression and bag it up, even though I may spray it down. I mean, and I'm not saying that the protocol isn't correct on how to clean things and transfer, but if you can minimize those types of things, and I think that's really where the iOS scanner or digital scanners started really taking off, so dentists could digitally capture the environment. And at that point, we know it's captured, it's sent, and the lab's not receiving anything that has anything of a concern, and they can produce and fabricate. Then obviously it's the shipment back of the prosthetic device that was fabricated back to the environment, and obviously that has to be sterilized and bagged and what have you. And those are the little things, I think, that started adding together to give confidence to the patients to start wandering back in and taking the treatment plan that's recommended by the dentist and following a nice protocol. Could you tell us a little about how you got introduced to, I mean, I might take us back a little ways, but I think it's important for the audience to understand that you may have grabbed onto technology for a different reason, whether it was clinical or it was just because you love technology. Could you just kind of share with us a little about your history with digital dentistry?
Sure, absolutely. And you know, I started back in 2010-ish. You know, it's funny because my wife, she is a computer engineer, and I never thought I was going to be applying all these kind of things into dentistry. It was kind of both. You know, I had some I have been interested in technology for many years, but when you combine both things, when I was combining this in residency, I never thought I was going to be able to have more efficiency, and I was going to be able to do more predictable treatments and offer that to my patients. So when I started, I basically started using like whatever we had at the school. At the time, it was different systems. You know, we had Planmeca. I was exposed to CEREC. 3D printing was not even considered because at the time it was really expensive, and the dental printers were something that only big labs used to have. So I started with, you know, the traditional systems, chair side, and then I moved towards, at the time, free software. So I noticed that for whatever reason, I was just curious to try different things. You know, as resident, you have all the freedom in the world to try different things. So with one of my colleagues, and the funny thing is I work with him right now because his name is Mark Ludlow, and Dr. Ludlow has been involved with digital dentistry for a long time too. He used to have a private practice, and I still remember when I was, you know, coming to the resident room, we were discussing different ideas, and he was telling me like, man, you know, I used to do this when I was in private practice, and I used to do these workflows. And I found that really interesting. So we started to, you know, discuss and brainstorm different ideas. At some point I said, well, what if I can maybe not use free software to you know, do restorations or design restorations, but what if I can do things like wax-ups, things of that nature. And so I started by using free software, Mesh Mixer, Blender, Blue Sky Bio at the time, and I still work with Blue Sky Bio developing some different functionalities. So I started with free software, and then one thing led to the other. Then we incorporated 3D printing into the equation. Then it became a little bit more affordable. We started doing some research about different printers. At the time, we're just like Kickstarter projects, and now they're like big companies. And then it just like, I fell into this, I will not even say addiction, but it's a true passion, because I don't see myself now practicing without this kind of things, just because I see the advantage. So it's cool to see how people sometimes when they start and they take my courses, they know a little bit, they start doing things, and then all of a sudden you see their progress and they become experts, and they have all this passion. They like to share ideas. They like to develop their own workflows. It's very, very motivating. So after doing that, you know, the more you do, the more problems you start noticing. Some of those problems were basically like, hey, well, everything is nice, but how can we actually, you know, have an affordable line of scanners? How can we have an affordable line of printers? Something that most people can use, and not only the blessed ones, you know, the blessed people that had a lot of years practice and they already have a budget to invest in this kind of things. So my mission has always been an easy entrance to digital dentistry. I developed my library, you know, my personal library that I gave for free. One of the guys, a prosthodontist, his name is Nathan. And Nathan Farley came to me one time and he said, "Well, you know, you gave one of the guys I know that is working with Blender. You gave this library for free. You know, can you give it to me? Can you give it to some other people that I know?" And yeah, I started giving that library for free, and then I noticed that people were actually appreciating those kind of things. And it was based on that, you know, based on the fact that I think there has to be an easy entry for people, especially dental students, residents. When I was in residency, I said, well, this is wonderful, but what the hell I'm going to be doing after I graduate, because I don't have the budget. I don't have the purchasing power to acquire an intraoral scanner, a 3D printer, softwares. It's crazy. It's crazy. I want to do it, but I don't have the budget. So this whole journey has been amazing in working with companies like, you know, like yourself, like Medit, and some more Blue Bio, some more companies that have been willing to actually say, hey, we're willing to listen to you guys. Whatever you guys suggest, we're going to consider it, and we're going to help you guys to have an easy entry to all these platforms and tools and workflow.
Yeah, I think that's a great point about, you know, if you're in your residency or you're in school, you see these technologies and you get excited, but then the real world hits you and you say, oh my goodness, it's not going to be that inexpensive to kind of get involved, even though that's where you would want to start when you entered into your own practice. You know, some of those, it's ironic because Medit was founded by a couple professors in South Korea who did their formal education in the US, Harvard and MIT, but, you know, they understood that kind of need of the new entries into the space. And so when they built this iOS, and you know, they have a long history in the lab with their tabletop scanners and a long history in the industrial space with industrial scanners. So it's been around a long time. I mean, we just entered this space in the clinical arena probably 2 years ago. And, you know, because of price point and a few other things, it made it a little easier for people to at least start their solutions, I guess is a better way to put it, instead of, you know, I think everybody wants all the toys, all the tools, but sometimes you have to start somewhere, and collecting the information is probably the most important thing. You know, and so that's where Medit really focuses, and that's really what they do as a specialty. They build the devices that collect the data. I see behind you, you have a tabletop scanner. And I have one of the iOS scanners over here, you know, and these are the tools that we have for the dental space today. But really what, you know, I think is really interesting that I've been watching during this downturn in business in general is everybody's desire to jump on some kind of platform, you know, whether it's a video platform, Zoom, or all these different tools to communicate. And really what I think people may or may not understand about Medit is we aren't just device manufacturers. We have built a platform called Medit Link, and within Medit Link has iScan that actually is the scanning software. But in the platform, it's a communication device for those that want to transfer work to their laboratories. It's a place for laboratories to manage their workflow and dentists to get real-time stats on what's going on in their space based on what kind of procedure they're doing. So, yeah, I don't, you know, I don't know if enough people understand that, you know, now that everybody in the world seems to understand what Zoom is today and how to use Zoom, and that took place in 2 to 3 weeks, it seems like everybody figured it out. I think dentistry has an opportunity to really take a look at itself and say, okay, how are we going to do procedures going forward that will simplify the procedure, the process, and also support the fears that patients may have, coming back into the space. So the whole platform side of things, even though we're not fully built out yet, I mean, we're offering unique apps today and things of that nature. Can you speak a little about what you know about that space? And, I know some other companies are doing it as well, but I just really kind of want to point that out, because I do believe when we talk about the tools that are going to bring or help people out of this kind of world we're in today, they're going to look for new tools to help motivate themselves, their staff, the production that they may be able to do, and the collaboration. I mean, the nice thing about the platform is they be introduced to other fabricators, other people out there that have unique solutions. Because as you said earlier, and I don't know if you jumped on the fact that using a handpiece in the office today is really kind of the big risk of aerosol and things of that nature, but there's so many other dental procedures that can be done today. And we know production, many offices that are GP related, 80% of their production is in crown and bridge, and even a single crown is usually a good thing. But it's evolved where GPs are starting to do a lot of everything, ortho and all these other procedures. So, I mean, I know I've gone on about it, but tell me what you feel or what you see in a platform-based kind of tool today for not only transferring your work, but also collaborating.
Yeah, absolutely. I mean, what you said is a really interesting point. Most of the private practitioners, they don't really see the disconnection of just like they just work, create a budget, buy whatever they need, and they keep going, right? But they don't see the disconnection that we see as an academicians of teaching students and residents what we will consider the ideal workflows, and then having them go open a practice or join somebody, and they're not able to implement these kind of things. So the way that Medit has jumped in a way that, you guys actually listen to the user, and you guys capture those ideas and implement. I still remember when we talk about this, possibly like years ago, I don't remember, I talked to Michael Lee as well. And we were talking about the fact that the most important thing in a system is not actually the hardware. I mean, the hardware is extremely important, but we got to the point that technology right now, the big companies, they have pretty similar hardware. They have different technologies to acquire data. They have I get all that stuff. But when it comes to we're trying to go down to the microns on things, who can provide me 1 micron more or 1 micron, or what is a little bit more accurate. But what is important, and what I tell people when they go to my courses is, yes, I mean, that is important, but the most important thing about the system is actually the brain of the system. It's actually the way the software operates. And it goes hand to hand, but part of the software, as you were saying, is how that software can integrate with things like cloud spaces. That is definitely the future. I mean, we see it in everything that we do. Dropbox, cloud services, Apple, Microsoft, everything has gone to that technology, because it's not only what is behind the technology. I mean, it's going to be even more important in the future, but we need workspaces. We need the clinician and the dental technicians. They need HIPAA compliant portals so they can share data safely. Data that belongs actually to our patients in our practices. We don't want to be hacked. There's a huge liability with that. In addition to that, is not only a place to share data, but also a place to analyze data, which is truly important. I mean, it's not the fact that I can export an STL file and send it to whoever. Is the fact that at some point, as you were saying, something like MeditLink dashboard, the first thing that came to my mind when I first saw it was like, this is amazing for private practice. You can analyze, in the future, you will be able to analyze production, You will be able to provide reports. You will be able, in a private practice environment that you have different associates, you will be able to see how many crowns they're doing per month and how many the data they're exporting per month just by logging into the service. So that's great. And I would probably say the most promising things that are gonna come in the near future is the integration of that data analysis with things like AI developments. So if you incorporate artificial intelligence to the fact that you can analyze the data, but it can also give you live feedback of what you can do better, or how can you improve the things that you're doing to be more productive, more efficient. That's where the future is going to come. So it's not the hardware per se. I know the hardware is important, but it's the fact that, you know, when you combine this with a really smart software, man, it just blows my mind the different possibilities we will be able to have in the near future.
Yeah, that's a great point. And yeah, obviously we feel we have a great piece of hardware or multiple hardwares, but you're right on point. When we start to really focus on the things that'll change dentistry for the better, to help people collaborate, communicate, and things of that nature, you know, and you were I mean, we found a good connection with you early on, and you mentioned Michael Lee, and Michael Lee is obviously one of those unique individuals that listens to the clinical, the labs, everybody, and has a good enough wherewithal, understanding what's important based off of the way that you guys share your knowledge, and you have direct access, which is a beautiful thing. And he loves to communicate as well. He's done a great job, and I think what we'll see going forward will even blow everybody away. I mean, I honestly appreciate you saying that about the platform, and because really this is why people need to explore, you know, digital dentistry. And, you know, it's not just going to help them because they have a scanner and they scan and they're able to transfer the work, even though that's a critical part. But then they can rethink about the collaboration. You know, and I'll go back and just to tell us a little story, you know, even going back to that SARS scare. I mean, I had another involvement in a company in the printed circuit board industry, a little separate from dentistry, but what I was trying to understand back then was an analog to digital transformation. And, you know, I managed about 30 to 40 digital designers for the printed circuit boards. And the thing that amazed me was the ability to get a large design done in less than 24 hours. And the reason for that is there were these great design platforms that allowed multiple designers to collaborate and work together. And then not only that, they didn't work in a brick and mortar, they worked from their homes, and they shared a lot of this, you know, sequencing of design. And, you know, we basically were a design service company. So one of the things that I see happening in dentistry is more of that type of collaboration, whether it's within a laboratory space. But I think the lines get a little blurred when it's dentist, laboratory, designer, patient. You know, there's all this opportunity out there. Once people get comfortable on these platforms and they understand what their input into that final solution will be.
And right now, because, you know, I want to go back to the topic of COVID-19, because you brought up a really interesting point. I don't have any evidence whatsoever to say this, but I think from the, you know, intraoral scanners, from the hardware standpoint, I think it's going to help us tremendously when it comes to how we can minimize exposure. You know, some of the things that we notice, people that are really into digital dentistry, is that, you know, you are way more efficient with an intraoral scanner than with traditional methods. By owning one of these devices, you can reduce the appointment time and consequently the possible exposure time with our patients. On the other hand, you also mentioned that one of the interesting things about this virus is that it can stay on surfaces for a long period of time. So, you know, the fact that it can also become a standard of care later, to say, hey, listen, it's better for you to use something like an intraoral scanner, use technology to minimize exposure in the population. You don't want to rely on, I mean, on your dentist to get impressions and models if you know those can be contaminated. And if you do as a dental technician, you have to disinfect, you have to follow different protocols as well if you're receiving all these kind of things, you know, records, impressions, all that stuff. Now, if you receive data, there is 0%, you know, exposure risk. So from how like we control the exposure from that perspective is way better to use technology in that way. Now, we were talking about workspaces, and one of the things that I foresee in the next couple of months, as far as opportunities and how to enhance the business, especially from the dental lab standpoint, is teledentistry. We have been talking about this for years, and now we're kind of getting forced to get into that space. The clinician obviously is still dependent on seeing patients, and that requires, you know, a physical contact, and we're limited by that. But from the dental lab standpoint, it's way more efficient for you to receive the data, you know, develop basically workflows with our clinicians in order to your lab to be more efficient. And that's a true opportunity right now. You know, if you can minimize that, if you can be more efficient. I even know some labs that are buying intraoral scanners to give clinicians just because they don't want to deal with chipping and with less efficient protocols, you know, and that's really interesting.
Yeah, with a good workspace, as you kept referencing back, there's a great opportunity, even though some procedures may not be warranted right out of the gate when patients start coming back, collecting that data, starting to get it into the treatment plan, doing teledentistry back and forth to all parties to be able to get to that phase where patients can make the decision in a positive sense to get the treatment that they've been needing and wanting for many, many months now. So yeah, no, I think all of that ties together. You know, and it's funny because I know dentists, and for many, many years I've been in this space. I don't even want to throw the number out there, but I know most dentists are very innovative in a lot of different ways. They spend a lot of time trying to create solutions. We do know that this disease and most diseases come in through the oral environment or sinuses or what have you. So who's to say that, you know, and this is where digital really helps development, because you can look at things differently. So capturing the oral environment in a digital sense and maybe designing something that could be unique or different. I mean, we think about night guards, we think about clear aligners, we think about all these appliances that can be fabricated. There's no doubt in my mind that in the future or near future, some dentists out there will come up with some solution other than a mask that may actually help in this environment as well. That's me thinking a little, you know, optimistically, but you never know. You never know.
Oh, I agree 100%. I think eventually, you know, we'll get to the point that nobody questions that an intraoral scanner should be part of your practice regardless, just like a dental chair, just like some more instruments that we use. So, you know, it's just a matter of the evolution. I really love the way, and I shouldn't say this, but like, I really love the way that you guys actually disrupt the traditional price tag that we used to have for this kind of things. So, like, you know, if it is a more affordable line for people, if the quality is, you know, is there for people to use things, like, why not just make it part of the practice? Why not just like go ahead and make it part of the package that people used to have back in the days when they go to big distributors and say, hey, I need a a dental package to start my practice and having an intraoral scanner as part of it.
Yeah.
I think it should be part. I mean, honestly, obviously we have to consider return on investment, and that's a big thing. But if you're going to be a restorative dentist, if you're going to be an orthodontist that is going to be doing this every single day, come on, it's a no-brainer.
Yeah. Well, I mean, I agree, and hopefully the audience has, has some feelings on that as well. We're gonna do a Q&A, and anybody out there that's kind of listening, if you have a question, just throw it into the side panel over there. But also at the end of this Q&A will open up, and we'll try to do it here live for a little while. We're kind of limited on time, but we'll try to do that for a little while. And then if for some reason you're not able to get in, then just leave it in the Q&A section, and we'll kind of respond to it after that. But I really want to, give you the last few words. If you have anything, Dr. Brenes, that you want to kind of finish with, I really do appreciate your time today and your insight. You're a valued partner, and I know you work with many companies. You're not limited to Medit, but if you have a couple last words for the group, and then I'll try to open it up for Q&A.
Yeah, no, I mean, I absolutely appreciate the fact that you guys are willing to do these informal interviews. I love them just because, people can ask whatever they want. I mean, if you guys want to ask me what's my favorite color, whatever, just go ahead and ask. It's always nice to have this informal, discussions. It's always nice to cheer. And I truly, you know me, Brian, and I'm really blunt when it comes to say things. I don't get muted by the fact that people will sponsor me or whatever. So I don't really care. But I truly respect companies that are that have their willingness to listen users, to help people, to help evolve their practices. And I really appreciate that. I started from my selfishly point of view of how can I personally benefit, how can I treat my patients better, but at the same time, from a more academic standpoint and more objective standpoint, it's always nice to share the knowledge, spread what we know, try to impact. My main motivation is to try to impact as many people as I can by helping them, implement something, a workflow, a technique that can help their patients and their practices. So again, I truly appreciate. I enjoy collaborating with everybody, with you guys as well. So
yeah, no, well said. And to your point, just coming back to the whole Zoom thing, how if we remember watching some of the funny videos that we've seen, people trying to figure out what button to press, and they're live on camera, they don't even realize it, things of that nature. I would tell you, in a very short amount of time, these individuals have become very efficient in using these types of platforms. And and I think if people are smart and have time and want to dig in, I see a couple questions right now with a doctor out of India asking, how do you kind of learn more about this? Obviously, Medit.com is an environment that you can jump on, but also support.medit.com is an environment that answers all the questions, has videos, things of that nature, where you can jump on and kind of learn more about how this works and that works. And keep in mind, Medit Link is free to everybody. You can jump on, establish a platform, sign up, and that's a free service. There's no cost or what have you. And if you add a device, you can add a device down the road. I'm going to leave it at that. I'm going to once again take a look. Let's see. I see a couple questions over here. Yeah, so a lot of content is in our support.medit.com area as well. I think we covered the things that we wanted to cover today. We know it's tough out there for everybody. I think Dr. Brenes and myself I want to thank you for spending the morning with us, or evening in Europe, or wherever you may be. And, let's stay positive. Let's look for the little things that we can all do to add value back and get this industry, which has always been a great industry. And, it's really an important part of health for all humanity. So thanks again, and we're going to sign off, and appreciate everybody's attention. Have a great day, everybody.